Hey guys, I'm Danny.
And I'm Carrie, and we're nursing students from PHSC.
And this is our friend Renee. Renee's agreed to allow us to teach her a little bit about diabetes and the effects that it can have on our feet.
You guys said we were just gonna go get food?
You're gonna get food once I get my grade.
Alright, you guys always drag me into this stuff anyways.
Alright, Renee. First thing we're going to talk about is diabetes and the effects that it has on our feet.
Alright.
Well, we know that diabetes is a disease that is accumulation of too much sugar, also known as glucose, in the blood. The high levels of sugar in the blood can cause damage to nerve fibers through the body. The damage to the nerve fibers can result in a loss of sensation and cause pain in the extremities, most commonly in the feet, which is known as diabetic neuropathy. Oh good, there you are, Timmy.
Danny, what is going... Did you just call me Timmy?
Here you go, doctor.
Thank you, nurse.
Doctor.
Oh, there you are, Timmy.
Did you just call me Timmy now? What's going on?
You're so silly.
I'm glad you're with us, Timmy.
Oh,
we were
boy.
just discussing the effects that diabetes has on our feet.
Alright.
Nurse Carrie is now going to explain to us the complications that they can have.
Indeed. Uncontrolled diabetic neuropathy can lead to further complications if not treated properly. Complications of diabetic neuropathy could result in bone infection, foot ulcers, and even amputations. Due to these complications, it is extremely important for patients to give extra attention to their feet.
That's correct, nurse. Now let's go to our trusty nurse,
Ashley.
Why, thank you, Dr. Dan. Mr. Lindsay is a 63-year-old man who's had diabetes for 23 years.
Mr. Lindsay likes to live a full life, and after spending his days at the lodge, he needs to relax and unwind. He doesn't have time to worry about something as silly as neuropathy. His doctor said something about the dangerous effects of neuropathy if it isn't taken care of. But he doesn't feel anything, so he knows he's fine. He'll just skip his foot care. He can't really reach it anyways.
Doctor, could this have all been prevented?
I'm glad you asked, nurse. Let's see what could have happened if he had done proper foot care.
Okay, Mr. Lindsay. I've been hearing you've been having some difficulty reaching those feet of yours to take care of them. I'm here with some special tools to help you clean those feet and get them in tip-top shape. All right?
Okay.
All right. So the first thing you're going to do after you come out of the shower and wash those feet, I want you to thoroughly dry them. So if you could go ahead and dry them on the bottom of the table there for me. Perfect. Now after you've dried those feet, this is a very important step. I want you to take this handy tool here that's going to help you get in between those toes. So if you can go ahead and dry in between the toes. Excellent. Now this is going to help with moisture collecting in between the toes, preventing fungal infections. Thank you so much. Now after you're done drying the feet, I want you to go ahead and use this to examine the bottoms of your feet. And there's a mirror attached at the bottom, okay? And you're looking for any cracks, bruises, or cuts. And if you notice any of these things, I want you to contact your doctor immediately. That is very important, okay? Now after you've examined them, you need to put some lotion on the feet and moisturize them. So what I'm going to do is put some lotion on the bottom there and you're going to rub, okay?
Okay.
Now go ahead and rub those feet in there. And moisturizing the feet is going to prevent them from cracking and drying, which is going to help in those complications that we talked about earlier.
Oh boy, now I can really be king of the dance hop.